How you doing? I'm Nick. I'll be your student nurse today. Can I get your name and date of birth, please?
Sure. Pearl Fire Scale, June 15th, 1929.
Perfect. Are you feeling any pain today, Peril?
Nope.
No pain?
Nope.
All right. Do you know where you are right now?
I'm in the hospital.
Yeah. And you know why you're here?
Yes, I broke my back.
And one more question. Do you know what the year is?
2020.
Perfect. All right. Next, we're going to be doing a little neuro assessment. So I'm going to check your perla to make sure your eyes are equal and react to light. I'm just going to shine a flashlight in your eye just to see how your pupil is dilated.
Okay.
Good. Perfect. And can I have you look straight ahead? And now look at my finger. Good. And do it again. And look at my finger again and track it into your nose. Perfect. And 4 millimeters. So your pupils are equal and react to the light and accommodation. Next, I'll be doing some assessment of the rest of your body. First, I'll start with your heart sounds. I'll auscultate your heart. Then I'll move down to your lungs, your abdomen, and then your feet.
Okay.
Actually, first, I'm going to have you squeeze my hands, though, to see your grip strength. All right, so those are equal bilaterally. All right, and next, I'm going to do your lungs. So I'm going to just put my stethoscope on your chest and just breathe normally while I do it. All right, your heart sounds clear. No abnormalities with the beats or anything like that. Next, I'll be doing your lung sounds. Have you felt any shortness of breath or labored breathing?
No.
No, and your oxygen level is set at 2 liters. So next, I'll be auscultating your lung sounds. And this time, I'm gonna, whenever I put my stethoscope on your chest, I want you to breathe in and out through your mouth deeply. All right.
Sure.
All right. I'm going to have you move over to your side. I'm going to have you grab your armor. There you go. Right, I'm just going to do the same thing just on your back. So continue breathing deeply when I put my stethoscope on you. Good. Good. All right, so your lungs were clear bilaterally. I'm going to have you roll back over here. All right, so next we're going to move down to your abdomen. I'm going to check. I know you have a PEG tube in that for your feeding. That looks clean, intact, and dry, intact. So is there any tenderness in your stomach area? I see no distension either. So next I'm going to auscultate to make sure I hear some good bowel movements, starting with the right lower quadrant. Good. Good. All right. Bowel sounds are good. Next I'm going to palpate your stomach to see if there's any tenderness during that. I'm going to do light to start and then harder after that. Just let me know if there's any tenderness when I do this. Any tenderness like that?
No.
All right, I'm going to go a little deeper. Any tenderness?
No.
All right, good. So that's all good. Next, I'm going to move down to your feet, but first, I know we took out your catheter earlier. Is there any issues? Any pain down there? No pain. Do you have any urge to go to the bathroom right now?
Not right now.
All right. Just let me know. I have your call bell. So if you ever need to go to the bathroom, just call that and we'll move you to the commode. So next, I'll check your feet. I'm just going to move this up. I'm gonna have you push down like you're pushing on a pedal and pull up. All right, so you're equal bilateral strain. All right, so I'm gonna take off your socks now. I'm gonna check your pulses in your feet. Good. Good. And I see no discoloration in your feet. Do you see a podiatrist
I do.
regularly?
I do.
And how often do you exercise? At least maybe 150 minutes a week?
Definitely.
Definitely. And you are keeping on your diet? I know you're on a carbohydrate diet and a low sodium diet. And you don't feel any tingling or numbness in your feet?
No.
Okay, perfect. All right. So is there anything else while I'm still here that you need?
I don't think so.
All right, I'll be back soon. Again, here's your call bell. If you need
Thank
anything,
you.
just use it. And I'll be back soon to check on you.
Thank you.
Bye, Carl.
Come in.
Hi, Carol. I saw that you rang the call bell. Is there any issue?
Yes, I think I have to go to the bathroom.
All right, you need to go to the bathroom? All right, so we're gonna get transferred to the commode right now. We're just gonna move this out of your way. We're gonna grab your gait belt. And next we're gonna have you swing your legs over so you can get up near the end of the bed and so we can easier to transfer you to the commode. So I'm gonna first swing your legs around, but I'm gonna have you grab the side rail. Perfect. All right, is that good? You're in a comfortable
That's good.
spot? Feel dizziness?
No.
All right. I'm gonna put the gate belt around you. Is that too tight?
Nope.
All right, can I have you spread your legs a little bit for me? Thank you. I'm gonna have you put your arms over my shoulder, and on the count of 3, I'm gonna stand you up, and we're gonna shuffle you over to the commode, all right?
Sure.
All right. 3, 2, 1. Up. All right, I'm gonna shuffle you over. I'm gonna have you reach back and grab the side rail of the commode, and then sit down. Perfect. All right, I'll let you do your thing. And then when you need my help, I'll come back and transfer you back to the bed. You all done?
I am.
All right, perfect. I'm gonna put the gate belt back around you. All right, and same thing as before. Put your arms on my shoulders. Spread your feet. And on the count of 3, we're gonna lift you up and transfer you back to the bed. All right?
Mhm.
3, 2, 1. Up. Perfect. All right, and grab the side rail right there, and slowly sit down. Perfect. All right, I'm gonna grab your feet. Is that comfortable?
Yes.
All right, perfect.
Feel much better now.
Feel better?
Mhm.
Was there any pain during urination?
No.
No pain? I see that your urine is a little bit cloudy and a little dark, so I'm gonna send it to get a culture and sensitivity. Is that all right?
Sure.
All right. Is there anything else while I'm still here? I'm going to come back in a little while to give you your medication, but is there anything else while I'm still here that you need?
No, I'm good.
All right, so I'll put your call bell next to your bed,
Thank
and your
you.
bed's at your lower position. And if you ever need anything, just make sure you use the call bell, all right?
All right.
All right, I'll see you in a little bit.
Thank you.
Cool. All right, now we're going to do our first check for our medication administration. First, we're going to give sertraline. Here it is. We'll give 50 milligram tablets. 50 milligram tablets. We'll give her a dose. Pero Fire Scale. This is the patient. We'll give 150 milligrams. So we'll give 3 of these tablets by mouth at 8 o'clock. Next is your metformin. Is her metformin. Pero Fire Scale. Pero Fire Scale. These come in 500 milligram tablets. We'll be giving 1,000 milligrams of this, and this will be given PO, also at 8 o'clock. And next is the Glargine insulin. This comes in a vial, 100 units per milliliter. Her dose is 16 units, so we'll draw this up. And this will be at 8 o'clock as well. All right, so now we do our second check before we go into her room. We got the sertraline 50 milligram tabs, again, for Pero Fire Scale. And we want 3 of these tablets because we're giving her a dose of 150 milligrams. So put this in her med cup. Oh, first I'm going to put it in capsule. All right, put that in her med cup. So that's good. Put this aside. Next is her metformin, 500 milligram tablets, and she needs a dose of 1,000 milligrams. So we're going to give her 2 of these tablets. So measure that out. So 2 tablets. Put this in our med cup. Perfect. Put that aside. Finally, we have our glargine insulin. And since this is a controlled substance, we're going to have to check this with another nurse before I go in the room after I drop the medication. All right, so this comes in a vial of 100 units per milliliter. She would need 16 units. So we're going to draw this up. I'm going to inject air first, flip it upside down, and pull out 16. I'm gonna go check this with a nurse before I go in the room.
Come in.
Hi, Pearl. I'm here to give you your nightly medication.
Hi, Nick.
Is that all right?
Sure.
Okay. How are you feeling right now?
Good.
All right. So I did my first 2 checks outside of your room, and I'll do my 3rd check with you right now. Can I get your name and date of birth, please?
Carol Firescale, June 15th, 1929.
Perfect. All right, with me today I have your sertraline, your metformin, and your glargine insulin. Your sertraline, I'm going to give you 50 milligram tablets, and your dose is 150 milligrams. I'll be giving you PO at 8 o'clock. Next is your metformin, 500 milligram tablets. Your dose is 1,000 milligrams PO. I'll be giving you this at 8 o'clock. And your final is your glargine insulin. This is a sub-Q injection. This is, and it'll be doses of 16 units, also at 8 o'clock. So first, your sertraline, I already measured it on this cup. And sertraline is your antidepressant. Have you had any thoughts of harming yourself? Any suicide ideation?
No.
No? Okay, so if that ever occurs with this medication, just let one of the staff members know. Also, another side effect could be dizziness or drowsiness. You feeling any of those right now?
No.
No. All right, so measured out already 3 tablets of this. Next is your metformin. This is for your type 2 diabetes. It controls your hyperglycemia, so it keeps your glucose level down in your blood. How often do you check your blood sugar?
Twice a day?
Twice a day is usually within the limit?
Yes.
All right, so I've already measured out 2 of these tablets, and I'll give you your water. Have you take those together?
Thank you.
There you go. Perfect.
Thank you.
You're welcome. All right. And finally is your glargine insulin, which is another diabetes medication. This is going to be sub-Q. And where was the last area that you got your injection?
On the left side.
Left side, so we'll rotate and do it on the right. You might feel a little pinch. I'm going to put this cold swab on you, just alcohol swab to clean the area. All right, and you might feel a little pinch. 3, 2, 1. Perfect. All right. And again, your glargine insulin is to control hypoglycemia. And you said your blood sugar is at a normal range usually, so that's good. All right, is there anything else while I'm still here that you need?
Could you turn the TV on maybe?
TV on? Sure. Find your clicker, found it, turn the TV on. Anything else while I'm still here? You got your water right there, put your call bell right here, bed's at a low position. Again, if you need anything, just use the call bell. I'm signing off right now. I'm going to be leaving, but you'll have a new nurse, and new nurse soon that's going to come and meet you.
Okay.
All right.
Great. Thanks,
Thanks,
Nick.
Carol. Have a nice night.
Thank you.
Today is 3/30, 2020. Patient is admitted to the facility after a spine fracture due to a fall. Notes slight pain, but manageable. Patient vital signs are within normal range. At last vital signs taken, the pulse was 88, temperature 99.1, respiration rates were 18, and the blood pressure is 128/78. The perla is present. Peripheral pulses are +2, it's strong. Heart sounds are clear. Chest expands equally. Lungs are clear and bilaterally, and there's no signs of shortness of breath or labored breathing. Her oxygen is set to 2 liters. Their strength is equal bilaterally in hands and the feet. The peg tube was dry, intact, and clear, and there was no sign of discomfort, distension, or tenderness in the abdomen level region, and bowel sounds were heard in her right lower quadrant. The catheter was taken out during my shift, and there was no signs of pain. The patient voided during my shift as well on the commode, and the urine was sent for a culture and sensitivity due to the discoloration and sediment in her urine. I'm going to see if she has a UTI. But also no pain was noted during urination. There's a use of a gait belt to move patient to the commode from the bed with assistance of a nurse. There's no signs of hypoglycemia or hyperglycemia. Current lab levels are listed at her H1C is 10.1%. Her glucose level is 156 milligrams per deciliter. And her serum albumin is 4.3 grams per deciliter. And the culture and sensitivity is being sent to the lab to be tested. And the patient received her nightly medication, her sertraline, her metformin, and her glargine insulin as prescribed. And overall, the patient was in good spirit.